Your A1C was 7.6
Yeah.
last month. That's the lowest it's been since you've been with us.
Yes.
Yeah.
And I want to get a tad bit lower.
Tad bit lower, okay.
Just 6.
So if you want to get your blood sugar a tad bit lower, then what we look at is that 13% of the time you've been high. Okay? So then let's look at when you've been a little bit high. This tells me that between 9 a.m. and 12 p.m. and then maybe again in the afternoon is when you tend to go the highest. Right? So then let's look over the...
So I've been coming to Neighborhood Healthcare Center about 2 years. I wasn't satisfied with my other doctor, and I asked my sister where did she go, and she said she went to Dr. Rebecca Stick. So I said, I'm gonna try her. And I called and made an appointment, and I came the first time to see her, and I've been coming ever since. Diabetes was crazy all over the place, and I was very disgusted with it. I just thought I could do no better. I was one of the people that thought I just couldn't get no better with the diabetes. I said, oh, and so I had just really given up until I met Dana. And she's gotten me eating all kind of crazy snacks, but healthy snacks that's panned out to be more better for me and got my diabetes under more control than I ever thought they would be. I feel good. I feel a lot better than I used to feel. And I just feel good. I come here for nutrition and wellness as well as the pharmacy. That has made it much easier. I don't have to bounce and go all over the place, here, there, everywhere. My primary doctor, Rebecca Stick, and my nutritionist work right here in the same place, and they confer with each other about changing my medication and this and that, and it works out real good. You don't have to be calling, waiting for nobody to call you back and all of this stuff, and and then you go right over there, she get right back to you, and it happens.
So patients like Laverne are why Neighborhood Health Center exists and why providers like myself love working here. I was connected to Laverne a little over a year ago through our diabetes case management program. That's a program where a care manager like myself works with the doctor and the patient to navigate things like their medications, their appointments, and just the general burdens and frustrations about managing diabetes to really help the patient succeed and make things easier for the patient. So after getting connected with Laverne through our care management program, we got her a medication reconciliation visit with one of our pharmacists, and then I started scheduling nutrition visits with her. We've met about 10 times over the past year, each time uploading her continuous glucose monitor, which provides me a report on how her blood sugars have been over the past few weeks. And then together, Laverne and I can look over her blood sugar reports and talk about what was frustrating, what was difficult for her, and come up with a plan that works for her. And then if she needs any medication changes for her diabetes, I'm able to just go right down the hall and talk with her doctor about some changes to her medications that would work. The doctor's able to make those changes, and then Laverne was able to go right over to the pharmacy and pick up any medications she needed. So working together with the pharmacy and her doctor and myself, we were able to provide Laverne the care that would make managing her diabetes a lot easier. But she has truly put in the work, bringing her A1C from 12.9 to 7.6 over the past year. So like you could see, she feels a lot better, she feels confident in herself, and she's happy with the care support she's receiving, which makes us happy as providers to be supporting her.